My name is Lachelle Moss, and I'm a nurse practitioner at Paris Pulmonary Clinic. I started out in medicine as a lab tech many years ago, and then I went back to school and got my RN at Jackson State, and I've worked in a variety of settings, OBGYN, and then med-surg, and then I opened a cardiopulmonary rehab unit. And during that time, I went back to school and got my nurse practitioner degree from Frontier Nursing University in East Kentucky. We had a lot of pulmonary patients on our floor at Regional, on the med-surg floor over there, and we had a lot of Dr. James Carruth and Larry Carruth's patients over there, and working so closely with them, I just really enjoy that patient population. I'm from a little tiny town, Shiloh, Tennessee. It's kind of near Savannah. I went to Adamsville High School and moved to Jackson when I turned 18 to go to school, and just kind of stayed, and I've been there since. We're actually trying to build a house in Milan, Tennessee right now. I am married, and me and my husband love to travel any chance we get. I like to go new places. We spend a lot of time at the lake, boating, fishing, that sort of thing. And then I have two wonderful little nieces that are the light of my life. I spend a lot of time with them as well. I've worked with Dr. Carruth for almost 10 years now. I've been with him at the clinic for several years now, and before that at Regional Hospital as a floor nurse, and then charge nurse with him, and then he was our director of cardiopulmonary rehab, the department that I started there. We don't see a patient once or twice like you would in an urgent care. We get to follow them throughout the course of a life and a disease process. We have most commonly COPD, but we also treat quite a bit of asthma, sleep apnea patients, pulmonary fibrosis, things like that. I went to work at Regional Hospital for a reason, because it was a small community hospital instead of the larger one in town for that reason, and that's one reason I like Henry County so much. It is a smaller hospital. I really enjoy a smaller clinic. We know everybody very well, you care about everybody, and that extends to the patients. Once you've followed a patient for so many years, you really get to know them, not just them, but the family that comes with them. You know a lot about their home situation. So you end up treating them like family by default, even if you don't mean to. We try to give a really personal touch to all our patients. We really care. That was one of the things that I loved about working with Dr. Carruth, is he cared more than any other pulmonologist for sure, but almost any other doctor I've ever seen. He always does the thing that's right for the patient, not necessarily the thing that's easiest, definitely, and not the thing that is going to make the most money. He cares. He wants to see the patient get better, not just them, but their family as well, because so many of these chronic diseases affect family members, not just the patient. And so, we really try to give good quality care, but also good personal care.